Welcome back to the Dr. K Kall. Today we're going to discuss hip replacement, and I'm going to discuss about the different types of hip replacement. This is your typical skeleton, and this is the pelvis. This is the hip. It's a ball and socket joint. Here it shows the attachments of the muscles, and we've talked about the different approaches to the hip, but today we're going to talk about the types of hips. So there are many different types of hips, and we have improved quite a bit in terms of how we do them, and also materials and quality of materials. And there's different degrees of bony resection with different hip replacements. One of the most minimally aggressive bone resections and hip replacements is called resurfacing, and I get a lot of questions about resurfacing. Resurfacing is used less today than it was perhaps 5 or 10 years ago, but it still is used. The issue with resurfacing is it tends to be metal on metal. And there are a whole host of issues with metal on metal. But in today's world, we still do some resurfacing in males under 55. So it is a very durable hip replacement, but it has the issues of metal on metal, and it has the issues of bone quality. But here's a pelvis, okay, and this is the ball. So when we resurface, we take and we shape the head of the femur like this, and we put a covering or a cap on the ball, and then we ream out the acetabulum and we put a cup in the ball. So as you can see, it's a metal on metal articulation. But it keeps your own bone, and so it's very bone conserving, and it has, if you don't get a metal reaction, it has very long longevity, particularly in young people, young males that have good bone. The more traditional implant that we use, and again these are models, but if I take this as the pelvis, and as you can see, it's a clear model of the pelvis. And we ream this out as we do in all total hip replacements. And then we put this porous coated or 3D printed titanium surface in there. And then we put a liner. In a liner, this is a vitamin E liner, and it is probably some of the latest technology, best wear. And then on the femoral side, we take the ball off, and we broach the canal of this for a stem. So here's a stem, and we can use metal balls, or more commonly today is we use a ceramic ball. So this is a pink ceramic ball, and we get the hip length by varying the depth of where this stem, this trunnion, goes into that ball. So we can make the hip longer or we can make it shorter. And a lot of that depends on your muscles. So here's our traditional hip replacement, okay? So this is a model of the pelvis with the cup in place with a vitamin E liner. That's a plastic liner, and there's all different shapes of these liner. We can have a high wall. We can have a constrained one that locks the ball in place. And so there's a lot of liner options. And then the head option tends to be ceramic or metal. And in today's world, we're using more and more ceramic. We have less issues with breakage and less issues with metallosis if we use ceramic. And then the stems tend to be titanium. Your bone likes titanium, and it likes to ingrown, and this porous surface, your bone attaches with a biologic attachment. And then we prepare the canal for this, so we have lots of different sizes in our OR. So this is your traditional hip replacement that is very good with today's materials, great longevity, and it can give you a very good long-lasting hip replacement. Now we have also started to do what's called dual mobility. So if we take this cup and we use the same traditional metal cup, so let's go back to our resurfacing example. Here's a metal cup, and if we put what we call a dual mobility. So you see here's a stem, a titanium stem with a ceramic ball and a high molecular weight polyethylene, so that's the plastic on the outside. And so now we have a cup with a ball within a ball. And so that gives you better stability. So in people that were worried about dislocation, this is a better option in terms of giving you more stability. Now it's more parts, and that can have long-term ramifications because there's more things that to go wrong, but it is certainly much more stable. And I use this in people that have shallow acetabulums where we have dysplasia. I also use it with people that have had spinal fusion because their pelvis doesn't move normally, and therefore we end up using a dual mobility. So the dual mobility option is very commonly used today, but it's still not as common as your standard hip replacement. So dual mobility, our traditional ball, fixed ball with a fixed liner, a fixed high molecular weight polyethylene liner. Vitamin E is better, better longevity, so we use it in younger people. It's the latest technology. And then I would go to a ceramic ball, which we discussed, and the ceramic ball looks like this. It's a pink ball. I don't tell my male patients that, but that is a pink ball. And then the other option is that resurfacing option that I discussed. So hopefully that clears up some of the questions about types of hip replacement. I hope this information was valuable. Thank you.